This is the second unit in Anatomy and Physiology. These lectures will cover histology, or the tissues in the body. There are four main tissue types that make up the structures of the body. These include epithelial tissue, connective tissue, muscle tissue, and nervous tissue. The epithelial tissue is used to cover surfaces. It will also make up glands and line the surfaces of tubes inside the body. The connective tissue is going to support and bind tissues together. It is a very diverse group of tissues that may initially look completely unrelated. This will include our energy reserves as well as our immune system. The muscular tissue is used for movement as well as generating heat. The nervous tissue is used for communicating and coordinating activities. Epithelial tissue is arranged in closely packed sheets in single or multiple layers. It forms the apical or edge surface and basal membranes for other cells to build upon. It is avascular without a blood supply, but it does have a nerve supply. It is also high in cell division to replace cells. One of the consequences of being higher in cell division is that there is also a greater risk of mutations happening in the cell. Most cancers, or at least the most common cancers, are found in epithelial tissues. These include breast cancer, prostate cancer, lung cancer, skin cancer, and colon cancer. Squamous epithelium is made of flat, irregular-shaped cells. This allows for the rapid passage of substances and will be found lining in places where things like gases need to be moved across the surface. These are good for the rapid passage of substances. Cuboidal epithelium are more cube-shaped. These are good for secretion and absorption and are found in places like glands because of their ability to produce secretions. Columnar epithelium are taller than they are wide, which makes them more durable than cuboidal epithelium. These are also good for secretion and absorption and will be found in places with a little more abrasion, such as lining the intestines. They may also have cilia or villi on the surface. Transitional epithelium has the ability to change shape. They may appear anywhere from cube-shaped to flat, giving the tissue the ability to stretch. These are found in the urinary bladder. Simple epithelium are a single cell layer thick. This makes them better for osmosis, diffusion, secretion, and absorption. Some examples of where we would find this tissue are simple squamous epithelium lining the heart and blood vessels to allow gas exchange. We will also see simple cuboidal or columnar in glands like the thyroid and ovaries that will produce hormone secretions. There is a link here you can view to see more details on histology. Ciliated epithelium have cilia on the surface. We see simple ciliated columnar epithelium in the trachea of the respiratory tract. The cilia also work to move mucus up the trachea so we can cough it up or swallow it. These cilia are easily damaged by smoke, and the loss of these helps contribute to a smoker's cough. Stratified epithelium has 2 or more layers of cells. This is seen with the skin. It offers protection against heat, microbes, and chemicals. If you have had a burn or abrasion that removes some layers of skin, you have experienced how much more sensitive that area of the skin is to temperature when you get in the shower or wash your hands and find it suddenly not able to tolerate a normal temperature of water. Keratinization is the deposit of a hard protein, keratin, which provides extra protection against heat, chemicals, and microbes, as well in the skin and the fingers. Keratin is the hard protein that we find in the skin and the fingernails, and also that helps make hair more durable. Glands are made of a specialized epithelium called glandular epithelium. These secrete a substance. We have two types of glands, exocrine and endocrine. Exocrine glands secrete their products into ducts or tubes to be delivered to a specific location. These include things like sweat glands and saliva. Endocrine glands secrete their products into the interstitial fluids and are carried throughout the body. This includes things like the thyroid, adrenals, and other glands, which we will discuss more in the endocrine system.